Thank you. Good morning, good afternoon, good evening to all. Let me start with the title of my presentation would be the end of the pandemic and beyond, because we are talking about building back better, greener and cleaner and all. So next. So I just wanted to say, next slide, please. I just wanted to say that from where I'm coming, it's Kerala, a province or a state in India, the southernmost part, well known for its development model, and we have a comparatively well-developed public health system and a strong local government system, and experience from a 25-year-old long People's Plan campaign, the local participatory planning exercise by the local governments. Next. And with regard to the stages of action, as far as the pandemic was concerned, it could be considered as endemic, epidemic, and finally it was pandemic. But then we in India declared it as a national disaster and a state disaster. So we approached it as a disaster. Next. So as part of the pandemic, naturally, as you can see, all those things which we all do, the isolation testing and contact tracing and physical distancing and treatment. And we also initiated the first line treatment centers outside the public health institutions, because we also had to unburden the public health system institutions also, and then the tertiary care. Next. I'm actually trying to focus more on the post-COVID situation rather than on these things. But I want to say that usually in the times of disaster for all of us, it's an emergency. It is like a war. We have to consider it as in a warlike situation. So there needs to be coordinated systems and coordinated efforts. As we say, uniformed and non-uniformed forces have to come together. And so naturally, it has to be a single point of command. So we say we need to have a command and control approach. And that is how our National Disaster Management Act and procedures say also. But also let us remember that in disasters, who is the first respondent, who knows the area, who understands the community, and who can reach the communities, and whom does the community know also is important. And that is where my next slide, that is where the local governments come in action, the subnational and finally the local governments. And here again, we started with the awareness generation of the Break the Chain campaign, then the rapid response teams in every ward in a local government, we call it panchayats and municipalities. Also regular daily updating of data, gathering details, monitoring the quarantine and the isolation. We actually interchangeably use isolation and quarantine and all, but practically it's about quarantine and isolation. And the food and support services, so that we decided that no one should be hungry during the time of lockdown and others. And that initiated the community kitchens by the local governments, and also specifically taking care of the vulnerable and the high risk. Especially we have a lot of migrant laborers coming into Kerala. So their issues, because they lost their jobs and they have to be also taken care of. And so daily stock taking and reporting and other things. And finally, as I said, the COVID first line treatment centers, which all happen at the local level, and the local governments have to be into action. Next slide, please. So, and this doesn't happen by themselves alone. They need to work together with the women's self-help groups, the health system staff, the accredited social activists, health activities, we call them the ASHA workers, the childcare center workers or the Anganwadi workers, and the volunteer teams, and the elected representatives and the officials. But basically I wanted to say was that it's all under the broad umbrella of the local government system, guided and supported by the state government. And it is multi-level governance and action. Even though we say it's single point of command and action, we do it in a multi-level governance and action. Next slide, please. But Rome was not built in a day. In Kerala, we have a strong local government system, experiences over the last 25 years on local governance. Especially we had a massive floods during 2018. And that is when the local governments plunged into action and people understood that it is the local government which can actually do these kinds of things. And so we had started preparing local action plan on climate change, as well as every local government was into preparing local disaster management plan in December 2019. And it is at that time that the COVID struck. But they had drafted the first draft of the local government led disaster management plan. This became handy for the COVID management also. And next slide. So when I say local government or a subnational government, it is not that everything is done directly by them. Different ways of doing, working with others. They plan, they do, they coordinate. In some cases, they lead. Some cases they support, some cases facilitate, negotiate with other agencies for the people, or sometimes devolve, delegate, network with other agencies, and of course the grievance redressal. So this is the different ways in which the local governments and the subnational government work. Okay, coming next slide. As we move on, there are all these primary recovery activities and other things, and continued surveillance and all. But basically, there is a knowledge, attitude, practice leading to behavior change. That is more important in this COVID situation. And it's not an individual change, but it's about community level changes which needs to happen. Finally, it is leave no one behind. Next. So as we move on, we need to address food security, short-term and long-term, poverty and hunger. That's also part of this. And employment and livelihoods, local economic development. We need to bring back the economy back at the local level. Land and water has to be considered, education, and of course the disadvantaged, the elderly and other vulnerable population. And we need to address climate change, disasters and other things. So there are the capacity challenges. Next. And as part of building back better, greener and more resilient, we have this no one to be hungry. And in that way, we have initiated under the leadership of the local governments and the women's self-help groups. We have 1,000 people's hotels and more, so that people are not hungry. This is subsidized food, and sometimes it is free also. 5,000 clubs for the elderly across the state. Clean and greener Kerala. We have a mission specifically for that. Rejuvenation of canals and roads and canals and ponds and other things, and organic vegetation and other things. And as you can see, 10 million trees to be planted in a year. Local employment assurance program, where 5,000 new enterprises at the local level through skill mapping comes in. And solid and liquid waste management, education sector and palliative care and other things. And we have an initiative called Rebuild Kerala Initiative post the floods. And now we also have the Resilient Kerala program, where we address climate change and disasters. And next. And we need to strengthen our local disaster management plan and climate resilient plans to come in. So this is how we are trying to see the greener, better, resilient Kerala program. Thank you.